Panic disorder is an anxiety disorder where you regularly have sudden attacks of panic and fear. Everyone experiences feelings of anxiety and panic at certain times. It can be a natural response to stressful or dangerous situations. Authors of a review found preclinical and clinical evidence that established CBD as an effective treatment for numerous types of anxiety disorders, including generalized anxiety disorder, post-traumatic stress disorder, and panic disorder. You can see my other video on CBD and blood flow in the brain for more information on its use and its dosages. Studies show that increasing intake of theanine can significantly reduce symptoms of anxiety, such as a racing heartbeat and increased secretion of immunoglobulin A in saliva. Theanine is extracted from green tea. It can have a calming effect on the brain, increasing the neurotransmitter GABA and increasing alpha brainwaves. Dosages can range from 100 milligrams to 1000 milligrams per day, as needed. Magnesium reduces epinephrine and norepinephrine synthesis and release, decreases anxiety and could prevent panic attacks. Magnesium deficiency, even when mild, increases susceptibility to various types of neurologic and psychological stressors in healthy human subjects and a diverse group of patients. The best form of magnesium is magnesium bisglycinate. In order to determine your daily dose of magnesium, you should slowly increase the dose until stomach discomfort or diarrhea is noticed. Then slowly reduce your dose until you find the maximum tolerable daily dose. As magnesium is responsible for hundreds of enzymes in the body, it can have a profound benefit over time. Some research suggests that having a vitamin D deficiency could also be linked with anxiety disorder. For example, a 2015 review study reports that people with symptoms of anxiety or depression had lower levels of calcidol, which is a byproduct of vitamin D breakdown in their bodies. You can get a 25-hydroxy vitamin D blood test to assess your levels and then supplement accordingly. Vitamin K2 works synergistically with vitamin D. Vitamin K2 normalized blood glucose, reduced anxiety and depression. The maximum daily dose of K2 that your body can absorb is 300 micrograms per day, so more than this dose is not necessary. A 2017 study found that people who had lower blood levels of vitamin B12 were more likely to have depression and anxiety. A 2018 study found that people who ate foods high in B vitamins, in this case yeast-based spreads like Marmite and Vegemite, had better anxiety and stress scores than people who didn't. You should take vitamin B12 as methylcobalamin sublingually for best absorption. Vitamin B5 also supports the adrenal gland, which reduces stress and anxiety levels and may also help here. During times of prominent anxiety and stress, your body uses more vitamin E, which can deplete your stores and lead to more intense anxiety symptoms. Supplementing with vitamin E can help your body restore its natural balance and provide some relief from anxiousness, stress, and depression. You should take a mixed tocopherol form of vitamin E for best results. It's also recommended to use vitamin C as an adjunct therapy for anxiety and for improving academic performance among students. A study suggests that a diet rich in vitamin C can help reduce anxiety levels and increase academic performance in anxious students. And the best form is liposomal vitamin C. The next best form is a non-acidic buffered vitamin C, the worst form being cheap acidic ascorbic acid. Bioflavonoids can also help improve the performance of vitamin C when consumed together. It's now been scientifically proven that the flavonoid vitexin is the most important component of the passion flower as it relaxes you. High doses of the beautiful plant are used to treat anxiety and panic attacks, specifically in the form of coated tablets syrups, or specially prepared plant tincture. Passion flower works like Valium, however, it doesn't cause the side effects that Valium has, like a dulling of the personality. Valerian is a herb that's been used for centuries to decrease anxiety. It's believed to work by increasing the levels of GABA in your brain. Hops also are commonly used orally for anxiety, sleep disorders, such as the inability to sleep, or disturbed sleep due to rotating or nighttime work hours, restlessness, tension, excitability, attention deficit hyperactive disorder, ADHD, nervousness, and irritability. Choline, which is naturally found in eggs, may boost memory, improve brain development, and treat anxiety and other mental health disorders. You can check out my other video on choline sources for nootropics for more details on doses and forms available. Researchers have found that people who took high doses of omega-3, which were over 2 grams per day, seem to have most reduction in their anxiety symptoms. Some people take up to 9 grams per day of an omega-3 EPA DHA fish oil blend. Omega-3s work synergistically with choline and uridine to create new brain cells. Amoxicillin succinate, or Mexidol. Mexidol is sold as a popular nootropic and as a powerful antioxidant, and has been noted to be a powerful hangover cure also. Authors studied 70 patients with panic disorder, 30 men and 40 women, with a mean age of 34 years. All patients had insomnia. Patients were classified into the main and the control group. Patients of the control group received an antidepressant only. Patients of the main group were additionally treated with Mexidol at 375 milligrams per day. The treatment duration was 2 weeks. A clinical and instrumental examination revealed the use of Mexidol enhanced the decrease in anxiety disorders, autonomic disturbances, and insomnia, and also improved quality of life of the patients. Another common research nootropic used for anxiety disorder is aniracetam. You can check out my other video on amoxicillin as a novel treatment for anxiety disorder, and my video on nootropics, Noopept and racetams for more information about aniracetam. People with panic disorder, panic attacks, and other anxiety disorders are often susceptible to sleep issues. These can cause insomnia, panic attacks, and other sleep problems at night. Check out my other video on herbs for sleep for more information on how to improve your sleep quality. One herb that's used for helping sleep, but is also used in the daytime for stress, is lemon balm. Preliminary research shows that lemon balm can reduce some symptoms of anxiety, such as nervousness and excitability. Lemon balm is generally well tolerated and considered safe for short-term use. However, lemon balm can be a powerful calming agent, but it should not be used by patients experiencing hypothyroidism, which is low thyroid function, as it may further lower their thyroid function. Chamomile. This daisy-like flower is synonymous with calm, making it among the most well-known stress-soothing teas. One 2016 study found that long-term use of chamomile extract significantly reduced moderate to severe symptoms of generalized anxiety disorder. Lavender, when consumed, can be a powerful calming agent helping with panic attacks. Check out my other video called One Herb That Can Help Replace Valium and Prozac for more information about this. Caffeine is known to create an anxious state, leading to insomnia, which further exacerbates panic attacks, so caffeine consumption should be eliminated. This is also true of all other stimulants. Avoid processed food and food high in sugar, because the body experiences fewer highs and lows in blood sugar, and this helps further reduce feelings of anxiety. Very simply put, a sugar rush can mimic a panic attack. The numerous benefits of exercise can also help to alleviate many symptoms associated with panic and anxiety. Physical exercise for panic and anxiety can assist in reducing the body's physical reaction to anxiety. In some cases, exercise can even help to reduce the frequency and the intensity of panic attacks. One final breathing exercise that can work wonders is to have a cold shower and to learn to control your breathing while doing this, as cold shock can cause hyperventilation, and this simulates the symptoms that you have when you're having a panic attack. So you want to do daily practice to teach yourself breath control. You can also check out my other video on bipolar, on OCD, on depression, on schizophrenia, and PTSD for other information about herbs and supplements that may be beneficial to panic disorder, as many health problems are related and have some similar symptoms and clinical manifestations.